WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Monday marks the 4th anniversary of COVID-19 being declared a pandemic by the World Health Organization. While countries around the world are recovering from those days, vaccination numbers are showing a significant number of people have COVID-19 in their rearview mirrors. Across the country, dismal vaccination rates against COVID-19, with only 18% of the population in Manitoba receiving their recommended dose of the vaccine. Part of the problem, not a lot of people even know how many doses they need.
Are any of you aware of how many shots you're supposed to have at this point?
5 or 4?
No, 3.
I think
it's 3.
Loretta's right, guys.
I have no idea. No.
Yeah, I got vaccinated during COVID, but haven't thought about it much since then.
We saw over 90% of Manitobans get that first dose, which is amazing. We've never seen uptake like that.
Dr. Joss Reimer, Chief Medical Officer for the Winnipeg Regional Health Authority, says people have to consider COVID boosters as another seasonal activity that they do.
I know it feels very frustrating to have to keep going and getting another vaccine, but what I want people to think about is just a way of maintaining your health.
Even though the stringent health restrictions seen during the height of the pandemic are no more, they are having a lasting effect from our health to our wallet.
This other pandemic of loneliness and social isolation is still very much a really serious issue for lots and lots of people.
We're also seeing high interest rates, lots of people having to repay their pandemic-related debt.
While we have made some progress since the onset of COVID-19, it's the blind spots experts say we need to look at if we want to be better prepared in the future.
We took, I think, for granted that we were overly prepared for that next pandemic. And then when it hit, we found out we were actually severely underprepared.
The people who are out there working in healthcare or not in healthcare every day, facing risk and still going out and doing what they could for their communities, it really made me proud to be Manitoban, made me proud to be Canadian.
In Winnipeg, Edward Jan, City News.